Today we are going to discuss about prevention in cancer. So there are different ways in which we can have cancer, and the most common type of patients that we see which request for prevention are patients who see that someone in their family has had cancer, like my mother had breast cancer, so will I have it? My father had prostate cancer, brain cancer, pancreatic cancer, will I have it? This is one set of patients. Another set of patients are patients who fall ill and then they have this feeling that, oh my god, I'm going to develop some big illness, maybe I will develop cancer. There is anxiety about developing a severe disease, and especially many of these patients have fear of cancer. The third common category are patients who have been told that your disease is such that you will have a tendency or you have a probability of developing cancer. So, like for example, if you see a white patch in the buccal cavity and the patient is a tobacco chewer or a cigarette smoker, then we say that you have a predisposing condition which can develop into cancer. Or if the patient has inflammatory bowel disease, then we say, okay, this can get converted into cancer in the future. These are the three main categories. And then there are other categories, like some of you mentioned, that emotions cause cancer, that grief causes cancer, or any kind of emotion which is having a bad effect on your body can cause cancer. So manage our emotions properly, manage our diet properly. Maybe our diet is deficient, maybe our diet is um, full of toxins, so we need to work on the diet. Or maybe we have certain kind of infections which can predispose us to illness. Hmm? One of you has written maybe parasitic infection can cause it. Or for prevention, um, we should prevent ourselves from accumulation of toxins, whether it is from air, diet, water, occupational, whatever. Right? So what should we do in such a situation? How do we prevent cancer? The first thing, or the first category, is how do we prevent cancer in a person who has had a predisposition because of a genetic history, genetic predisposition. Is there a medicine which can address this genetic predisposition? Right? So, yes, in homeopathy, there is a remedy that we give patient by studying their physical, mental, emotional makeup along with the lifestyle, diet, habits, or occupational exposure, etc. So, in this way, when we address all these three things, that is your physical illness, along with your mental predispositions or mental emotions, and your external exposures or changes in lifestyle which predispose you to disease, when we find a remedy which matches symptomatically to your physical illness, your mental suffering, and your lifestyle changes, that remedy in homeopathy we call as the constitutional remedy. This constitutional remedy will make sure that all the inherent illnesses that you have, whether they are present or whether they are past or they are coming from your genetic predisposition, they are cleansed out. When there is a cleansing happening, this cleansing produces more and more healthy cells in our body, and the more healthy cells will have a good or a more healthy genetic makeup, and this healthy genetic makeup will stop you from developing cancer. So the answer is very simple in homeopathy. Study the patient, study them carefully, study them in with regards to their past history, their family history, their present symptomatology, their present diagnostic illness, and then their mental makeup, and then their lifestyle. Where in these three, four factors is the disturbance happening in this patient? That disturbance, whether it is in lifestyle, whether it is in diet, whether it is in mind state, that needs to be corrected. So in every patient, this disturbance can be at a completely different level. That level has to be found out, and that level has to be treated and cured. If we do this, not only will you prevent yourself from developing cancer, but you will prevent yourself from having any illness, right? So that is what homeopathy has to offer. It will treat you at all levels, and it leaves no causes of disease to be addressed in your body, or it leaves no causes of cancer to be present in your body, so that you can again, or you may develop cancer in the future. That is the homeopathic approach to prevent cancer. So yes, like some of you have said, maybe I will do some meditative exercises to reduce my emotions, or I will do some diet plan, I will do some infection or toxin drain by exercising, by having good lifestyle, etc. Yes, those all are good complementary measures which will sustain your health. But the actual cure will always happen when we are able to treat the genetic factors, the family disposition, your present illnesses. These all background has to be cleared. The soil has to be made fertile. And now, in this fertile soil, if you plant good food, if you plant good air, if you plant good exercise, the plant will go and the plant will be healthy. But if I plant a very good plant and feed good manure, everything, but the soil is not yet cleansed, the soil is not yet fertile, then no matter how much good I put in, till the base is not good, that whole good things that I am doing may not help that much. Yeah, to make the soil fertile, to make the genetic matter fertile, we all need good homeopathic constitutional prescribing. So that's what I wanted to share with all of you today with regards to prevention of cancer. I hope you like this video and you learn something from it. I look forward for your suggestions, for your opinions, and what you feel that we should be doing in our next video. I really urge you to please write your comments so that we can share our knowledge with you. So till then, friends, till our next video, I would like to say bye bye.